If you're a man over 60, the way you're sleeping right now could be silently destroying your prostate health, disrupting your bladder function, increasing your risk of serious cardiovascular problems, and stealing years from your life. And the worst part, you probably have no idea it's happening. I'm Dr. Nerita, and I've been a urologist for 12 years. In that time, I've treated thousands of men dealing with prostate issues, frequent nighttime urination, sleep disruptions, and the cascade of health problems that follow. And here's what I've learned: the position you sleep in, your sleep environment, and your nighttime habits have a far more profound impact on your health than most men realize. You see, when you're younger, your body can compensate for poor sleep habits. But after 60, everything changes. Your prostate is likely enlarged. Your bladder capacity is reduced. Your cardiovascular system is more vulnerable. Your deep sleep is already compromised. And certain sleeping positions and habits can turn manageable issues into serious problems. I'm not just talking about feeling tired. I'm talking about waking up 5 times a night to urinate, developing dangerous breathing problems, increasing your stroke risk, worsening your prostate symptoms, and accelerating cognitive decline. But here's the good news: once you understand what's happening and why it matters, you can make simple adjustments that could dramatically improve not just your sleep, but your overall health and quality of life. Before we dive in, do me a favor, hit that like button right now. It helps other men find this critical information. Drop a comment below and tell me where you're watching from. And if you haven't subscribed yet, click that button because I share practical health guidance that can genuinely change your life every single week. Now, let me show you exactly what you're doing wrong when you sleep and how to fix it. Let me start by destroying the most dangerous myth I hear in my practice almost every single day. The myth is this: how you sleep doesn't really matter for your health. As long as you're getting some sleep, your body will figure out the rest. That couldn't be more wrong, especially after 60. Your sleep position, your sleep environment, your pre-bed bedtime habits, and even what time you go to bed all have measurable, significant impacts on your prostate function, bladder health, cardiovascular system, breathing, brain health, and hormone production. Think about it. You spend roughly 1/3 of your life sleeping. That's 6 to 8 hours every single day, when your body is either healing and restoring itself or being subjected to mechanical stress, poor circulation, breathing difficulties, and hormonal disruption. After 60, your body doesn't compensate the way it used to. Your prostate is likely enlarged, pressing on your urethra and bladder. Your cardiovascular system is less resilient. Your sleep architecture has changed. You get less deep sleep naturally. Your risk of sleep apnea increases. Your bladder capacity decreases, and certain sleeping positions and habits make all of these problems dramatically worse. I've seen men whose prostate symptoms improve significantly just by changing their sleep position. I've diagnosed dangerous sleep apnea in men who thought they were just sleeping fine. I've watched men reduce their nighttime bathroom trips from 5 times a night to 1 or 2 through simple sleep adjustments. Your sleep habits aren't neutral. They're either supporting your health or actively undermining it. And after 60, the stakes are much higher. So if you've been told that sleep position doesn't matter, or that waking up frequently at night is just normal aging, or that you don't need to worry about how you sleep, that's incomplete and potentially dangerous information. Now, you might be thinking, Dr. Nerita, if sleep position and habits are so important, why hasn't my doctor talked to me about this? Great question. And here's the honest answer. Most doctors, even urologists, don't spend much time discussing sleep habits because we're trained to diagnose conditions and prescribe treatments, not to optimize lifestyle factors. When a man comes in complaining about frequent nighttime urination, the standard approach is to check the prostate, maybe prescribe medication, possibly discuss surgery if it's severe enough. Sleep position and sleep hygiene rarely come up. It's not that we don't care, it's that we've got 15 minutes per appointment, and the healthcare system is set up to treat problems, not prevent them through lifestyle optimization. But in my 12 years of practice, I've made it my mission to look beyond just medications and procedures. I want to understand the full picture. What's happening in my patients' lives, their habits, their environment that might be contributing to their problems. And I've seen undeniable patterns. The men who sleep in certain positions have worse prostate and bladder symptoms. The men with untreated sleep apnea have higher rates of cardiovascular problems and faster cognitive decline. The men with poor sleep hygiene have worse overall health outcomes across the board. This isn't just my clinical observation. There's solid research backing this up. But research doesn't help you unless it's translated into practical guidance you can actually apply. So, I'm going to walk you through the specific sleep mistakes that are harming your health, explain exactly why they matter at a biological level, and give you actionable alternatives. Let's get into it. Number 5. Let's start with mistake number 5. And this is one that many men don't realize is problematic. Sleeping on your stomach after 60 is one of the worst positions for your prostate, bladder, and overall health. Now, I know some of you have been stomach sleepers your entire lives. It feels natural and comfortable, but let me explain what's actually happening to your body when you sleep this way. First, let's talk about your prostate and bladder. When you sleep on your stomach, you're putting direct sustained pressure on your lower abdomen and pelvic region. For a man with an enlarged prostate, which is most men over 60, this pressure compresses the prostate and bladder. That compression reduces blood flow to these organs, increases inflammation, and makes urinary symptoms worse. It's like spending 8 hours with someone sitting on your pelvis. Your bladder capacity is effectively reduced, and your prostate is under constant mechanical stress. This is why many stomach sleepers find themselves waking up with urgent, uncomfortable feelings of needing to urinate the position has been, compressing everything all night. Second, stomach sleeping rears havoc on your neck and spine. You have to turn your head sharply to one side to breathe, which puts your cervical spine in a twisted, stressed position for hours. This can compress nerves, reduce circulation to your brain, and cause chronic neck pain and headaches. Third, this position restricts your breathing. Your chest is pressed against the mattress, limiting how deeply your lungs can expand. This means you're getting less oxygen throughout the night, which affects everything from your energy levels to your cardiovascular health to your brain function. And fourth, stomach sleeping can worsen or even cause sleep apnea in some men because it affects the position of your airway and tongue. Let me tell you about a patient I'll call Raymond. Raymond was 67, a lifelong stomach sleeper. He was waking up 4 to 5 times every night to urinate, feeling exhausted every morning, and experiencing chronic neck pain. His prostate was moderately enlarged, but not severely so. Yet his symptoms were significant. I asked him to try changing his sleep position to his side. Just that one change. Within a week, he was down to 2 to 3 nighttime bathroom trips instead of 4 to 5. Within 2 weeks, his neck pain had significantly improved, and he was sleeping more deeply. The stomach sleeping had been compressing his bladder and prostate all night, making his symptoms far worse than they needed to be. Practically speaking, if you're a stomach sleeper, you need to retrain yourself to sleep on your side or back. I know this is hard. It's changing a lifelong habit, but here's how to do it. Start by placing a body pillow in front of you when you lie on your side. This prevents you from rolling onto your stomach. Put another pillow between your knees to keep your hips aligned and comfortable. If you find yourself on your stomach during the night, don't get frustrated. Just roll back to your side. It takes time to retrain your sleeping position, but most men adapt within 2 to 4 weeks. The improvement in your symptoms can be dramatic, and it costs nothing except a little adjustment period. Number 4. Now we're at mistake number 4. And this one seems obvious, but you'd be amazed how many men are still making this error. Drinking large amounts of fluid in the 2 to 3 hours before bed is setting yourself up for multiple nighttime bathroom trips that destroy your sleep quality. Here's what happens biologically. Your bladder capacity naturally decreases with age, especially if you have an enlarged prostate. A bladder that could hold 400 to 500 milliliters comfortably when you were younger might now feel full at 250 to 300 milliliters. When you drink a large glass of water, tea, or any other beverage right before bed, that fluid is going through your kidneys and filling your bladder during the night. Combined with your reduced bladder capacity, this means you're going to wake up to urinate potentially multiple times. And here's what most men don't realize. The sleep disruption from nighttime urination is often more harmful than the urination itself. When you wake up at night, you're pulled out of deep, restorative sleep. It takes time to fall back asleep, and you often don't get back into the same deep sleep stage you were in before. Deep sleep is when your body repairs tissues, consolidates memories, produces hormones, and performs critical maintenance. When that's repeatedly disrupted, you end up with chronic fatigue, increased inflammation, worse cognitive function, higher risk of depression, accelerated aging, weakened immune system. Essentially, frequent nighttime waking creates a cascade of health problems that extend far beyond just feeling tired. Now, I'm not saying you should become dehydrated. Proper Hydration is crucial for health, including prostate and bladder health, but timing matters enormously. Let me tell you about a patient named Walter. Walter was 69 and would drink a full glass of water right before bed because he'd read that nighttime hydration was important. He was waking up 3 to 4 times every night. He was exhausted, irritable, and his relationship with his wife was suffering because his constant bathroom trips were disrupting her sleep too. We made one simple change. Walter stayed well hydrated throughout the day, but stopped drinking anything substantial after 700 p.m. He'd have small sips if needed, but no full glasses of anything. Within 3 days, he was down to 1 to 2 nighttime bathroom trips instead of 3 to 4. Within 2 weeks, he reported feeling like a completely different person, more energetic, better mood, thinking more clearly. His wife was thrilled because they were both sleeping better. Practically speaking, stop all significant fluid intake 2 to 3 hours before bed. This means front load your hydration to the morning and early afternoon. Taper off significantly in the evening. No large drinks after dinner. Just small sips in the last few hours if your mouth is dry. Empty your bladder completely right before getting into bed. This one change alone can dramatically reduce nighttime bathroom trips and improve your sleep quality, which improves virtually everything else about your health. Mistake 3. Now we're at mistake number 3, and this is one of the most serious items on this list. Ignoring, snoring, gasping, or breathing interruptions during sleep signs of sleep apnea is extremely dangerous and is destroying your health in ways you probably don't realize. Sleep apnea is a condition where your airway becomes partially or completely blocked during sleep, causing you to stop breathing repeatedly throughout the night. It's incredibly common in men over 60. Some estimates suggest up to 30 to 40% of older men have it, and most of them have no idea. Here's why this is so dangerous. Every time your airway closes and you stop breathing, your oxygen levels drop. Your brain detects this and sends an emergency signal that partially wakes you up just enough to gasp and restart breathing. This might happen 10, 20, 30, even 50 plus times per hour. You usually don't remember these episodes. You might just feel like you sleep poorly or wake up frequently, but they're happening all night long. Each episode creates a cascade of problems. Number 1, cardiovascular damage. The oxygen drops and emergency wake-ups cause massive spikes in blood pressure and heart rate. Over time, this dramatically increases your risk of heart attack, stroke, heart failure, and arrhythmias. Number 2, brain damage. Chronic oxygen deprivation damages brain tissue. Sleep apnea is linked to accelerated cognitive decline and increased risk of dementia. Number 3, hormone disruption. Sleep apnea suppresses testosterone production and disrupts other hormones contributing to fatigue, weight gain, and metabolic problems. Number 4, increased nighttime urination. This one surprises people, but sleep apnea significantly increases nighttime bathroom trips. The oxygen drops and stress responses cause your kidneys to produce more urine and trigger your bladder to signal fullness. Number 5, chronic inflammation and oxidative stress. This accelerates aging and increases risk of virtually every chronic disease. The tragedy is that sleep apnea is very treatable, but most men suffer for years without diagnosis because they don't realize the signs. Let me tell you about Donald, who was 71. He came to me about frequent nighttime urination. His wife mentioned he snored loudly and sometimes seemed to stop breathing. Donald dismissed it. "I've always been a snorer." I insisted he get a sleep study. He was diagnosed with severe sleep apnea, stopping breathing an average of 45 times per hour. He started using a CPAP machine, continuous positive airway pressure, a device that keeps your airway open. Within 2 weeks, his nighttime bathroom trips decreased from 5 per night to 1 to 2. His energy improved dramatically. His blood pressure, which had been difficult to control despite medication, improved significantly. He felt like a new person. The sleep apnea had been destroying his health for years, and he'd had no idea. Practically speaking, know the signs of sleep apnea and get evaluated if you have them. Signs include loud, persistent snoring, gasping, or choking during sleep, often reported by a partner, waking up with dry mouth or sore throat, morning headaches, feeling unrefreshed despite sleeping 7 to 8 hours, excessive daytime fatigue, difficulty concentrating. If you have these symptoms, talk to your doctor about a sleep study. It could save your life. And if you're diagnosed with sleep apnea, actually use the treatment. I know CPAP machines feel uncomfortable initially, but modern devices are much better than older ones, and the health benefits are enormous. Number two, now we're at mistake number two, and this is specifically about optimizing your sleep position for prostate and bladder health. For men with enlarged prostates, certain sleep positions significantly worsen symptoms, while others provide relief. We already discussed why stomach sleeping is terrible, but what about back versus side sleeping? And does it matter which side? Here's what you need to know. Sleeping flat on your back can be problematic for some men because gravity allows your enlarged prostate and full bladder to press more directly on your urethra and pelvic floor. This can worsen urinary urgency and that feeling of incomplete emptying. For men with sleep apnea or heavy snoring, back. Sleeping makes it worse because gravity pulls your tongue and soft palate backward, obstructing your airway. Sleeping on your side, particularly your left side, is generally the best position for men over 60. Here's why. Side sleeping reduces pressure on your prostate and bladder compared to stomach sleeping, while also reducing the mechanical stress on your spine and internal organs compared to back sleeping. Left side sleeping specifically has some advantages. It improves circulation, reduces pressure on your venia, major vein, and can improve digestive function. Some men report better overall comfort and fewer nighttime disturbances when sleeping on their left side. But here's what's critical. Your hips and spine need to be properly aligned. If you sleep on your side with poor alignment, your top knee falling forward, twisting your hips and lower back, you create pressure on your pelvic floor and potentially compress your bladder and prostate. The solution is simple. Place a pillow between your knees when sleeping on your side. This keeps your hips stacked and aligned, reducing pelvic floor strain and pressure on your prostate and bladder. Additionally, if you're a back sleeper and want to stay that way, it's not terrible if you don't have apnea. Elevate your upper body slightly. Use a wedge pillow or elevate the head of your bed 30 to 45 degrees. This reduces pressure on your pelvic organs and can reduce nighttime urination. Let me tell you about Paul, who was 68. He was sleeping flat on his back and waking up constantly with urgent needs to urinate. His prostate was enlarged, but not severely. We made two changes, switched him to left side, sleeping with a pillow between his knees, and had him empty his bladder completely before bed, using a technique called double voiding, urinate, wait 30 seconds, try again, get out more urine. His nighttime bathroom trips decreased from 4 to 5 per night to 2. Just changing how his body was positioned reduced pressure on his prostate and bladder enough to make a significant difference. Practically speaking, optimize your sleep position for your prostate and bladder. Best practices: sleep on your side, preferably your left side. Use a pillow between your knees to align your hips. If you must sleep on your back, elevate your upper body 30 to 45 degrees. Never sleep on your stomach. Use enough pillows to support your head and neck in alignment with your spine. These positions reduce mechanical pressure on your pelvic organs, improve circulation, and support better sleep quality. Number one, and now we've reached mistake number one, the most foundational, most impactful sleep mistake men make after 60. Not maintaining a consistent sleep and wake schedule is destroying your circadian rhythm, disrupting your hormone production, worsening your prostate symptoms, and accelerating aging. Here's why this matters so profoundly. Your body operates on circadian rhythms, internal biological clocks that regulate virtually every system in your body, including hormone production, testosterone, cortisol, melatonin, growth hormone, bladder function, and urine production, blood pressure, and cardiovascular function, immune system activity, cognitive function, metabolism. After 60, your circadian rhythms naturally become less robust and more easily disrupted. This is one reason older adults often struggle with sleep. When you go to bed at wildly different times each night and wake up at random times each morning, you're constantly disrupting these rhythms. Your body never knows when it's supposed to produce sleep hormones, when it should increase or decrease urine production, when it should optimize testosterone production. The result is a cascade of problems. Number one, hormone disruption. Testosterone is primarily produced during deep sleep in the early morning hours. Inconsistent sleep timing impairs this production. Melatonin, your sleep hormone, becomes dysregulated, making it harder to fall asleep and stay asleep. Number two, Worsened urinary symptoms. Your body normally produces less urine at night by increasing production of antidiuretic hormone, ADH. Disrupted circadian rhythms interfere with this process, leading to more nighttime urination. Number three, poor sleep quality. When your circadian rhythm is chaotic, you spend less time in deep restorative sleep stages even when you're technically sleeping. Number four, increased disease risk. Circadian disruption is linked to higher risks of cardiovascular disease, diabetes, obesity, depression, and cognitive decline. I had a patient named Gregory who was 66. He was retired and had fallen into a pattern of staying up until midnight or 1 a.m., watching TV, sleeping until 9 or 10 a.m., sometimes napping during the day. He felt terrible, tired all the time, despite sleeping plenty, waking up frequently at night, low energy, brain fog. We established a consistent sleep schedule. In bed by 1000 p.m., wake up at 6 a.m., no daytime naps longer than 20 minutes. It took about 2 weeks for his body to adjust, but then everything improved. Better energy, fewer nighttime wake ups, clearer thinking, better mood. His body's circadian rhythms had been chaotic. Establishing consistency allowed them to synchronize and function properly. Practically speaking, establish and maintain a consistent sleep schedule. This means go to bed at the same time every night within 30 minutes, even on weekends. Wake up at the same time every morning again, even on weekends. Avoid long daytime naps. 20-minute power naps are okay, but no 2-hour afternoon sleeps. Get bright light exposure in the morning to reinforce your wake signal. Dim lights in the evening to promote melatonin. Production. Avoid screens, TV, phone, tablet for at least an hour before bed. The blue light suppresses melatonin. I know this sounds restrictive, especially if you're retired and don't have to wake up at any particular time, but your body doesn't care whether you have to work or not. It needs consistency to maintain healthy circadian rhythms. This is perhaps the single most impactful change you can make for your overall health and longevity. All right, we've covered a lot. Let's bring this together into a clear, practical action plan you can start implementing tonight. Position and environment. Stop sleeping on your stomach. Retrain to side sleeping, preferably left side. Use a pillow between your knees when side sleeping. If back sleeping, elevate your upper body 30 to 45 degrees. Keep your bedroom cool. 65T, 068 degrees. Fahrenheit. Dark and quiet. Fluid management. Front load hydration to morning and afternoon. Stop significant fluid intake 2 to 3 hours before bed. Empty bladder completely before bed. Double voiding technique. Limit alcohol and caffeine, especially in the evening. Sleep apnea. Know the warning signs. Snoring, gasping, daytime fatigue. Get evaluated if you have symptoms. Use prescribed treatment, CPAP consistently if diagnosed. Timing and consistency. Establish a consistent bedtime within 30 minutes every night. Establish a consistent wake time, even weekends. Get morning bright light exposure. Avoid screens 1 hour before bed. Limit daytime naps to 20 minutes. Pre-bed routine. Create a relaxing wind-down routine. Reading, gentle stretching, deep breathing. Keep bedroom for sleep only. No TV, no work. Address any pain or discomfort that might disrupt sleep. Start by implementing 2 to 3 of these changes. Don't try to overhaul everything at once. Build gradually and pay attention to what makes the biggest difference for you. Track your nighttime bathroom trips, how you feel in the morning, and your energy levels during the day. Most men notice improvements within 1 to 2 weeks of making these changes. I want to take a moment to talk about something that's rarely discussed, but that I see in my practice constantly. Sleep problems, particularly frequent nighttime urination, steal more than just rest. They steal your dignity, your confidence, and your quality of life. When you're waking up 5 times a night, every night, you're exhausted.